Nonalcoholic steatohepatitis, Nash. Nonalcoholic steatohepatitis, Nash, is liver inflammation. Possibly with liver damage caused by a buildup of fat in the liver. While it's not normal to have fat in the liver, most people with fatty livers don't have Nash. The disease affects 2% to 5% of Americans, according to the National Institute on Diabetes and Digestive and Kidney Diseases, NIDDK. Moreover, inflammation and liver cell damage can cause fibrosis, or scarring, of the liver. In particular, if the damage and scarring are severe enough, Nash may lead to cirrhosis or liver cancer. Nonalcoholic steatohepatitis, Nash, is much more serious than a simple fatty liver. About 20% of people with non-alcoholic fatty liver disease have nonalcoholic steatohepatitis, Nash. Causes of non-alcoholic steatohepatitis, Nash. People with non-alcoholic fatty liver disease, NAFLD, are more likely to have non-alcoholic steatohepatitis, Nash, when they have one or more of the following conditions: type 2 diabetes, high blood pressure, metabolic syndrome, obesity, especially with a large waist size, high levels of triglycerides or abnormal levels of cholesterol in their blood. Less common causes of non-alcoholic steatohepatitis, Nash: rapid weight loss, exposure to some toxins, certain infections, such as hepatitis C, disorders that cause your body to use or store fat improperly, certain medicines, such as amiodarone, codarone, pacerone, diltiazem, glucocorticoids, highly active antiretroviral therapy, methotrexate, Rumatrex, Trexol, synthetic estrogens, tamoxifen, Nolvadex, Soltamox, valproic acid. Symptoms of non-alcoholic steatohepatitis, Nash. You may not have symptoms even if you develop cirrhosis due to Nash. If you do have symptoms, you may feel tired or have discomfort in the upper right side of your abdomen. If you have Nash or get cirrhosis, you may have symptoms such as swollen belly, enlarged blood vessels underneath your skin, larger than normal breasts in men, red palm skin and eyes that appear yellowish, due to a condition called jaundice. What are the complications of non-alcoholic steatohepatitis, Nash? Nash can lead to complications, such as cirrhosis and liver cancer. Moreover, people with Nash have an increased chance of dying from liver-related causes. In particular, if Nash leads to cirrhosis, and cirrhosis leads to liver failure, you may need a liver transplant to survive. Treatment for non-alcoholic steatohepatitis, Nash. Treatment for Nash is a combination of all forms of healthcare such as medication, self-care, home treatment or near hospital care by a specialist. How do doctors treat non-alcoholic steatohepatitis, Nash? Doctors recommend weight loss to treat non-alcoholic steatohepatitis, Nash, because weight loss can reduce fat in the liver, inflammation, and fibrosis, or scarring. Of course, if you are overweight or obese, losing weight by make healthy food choices, limit the serving sizes to eat, and physical activity, they can improve Nash. In particular, losing at least 3 to 5% of your body weight can reduce fat in the liver. Better yet, you need to lose up to 10% of your body weight to reduce liver inflammation. Moreover, doctors recommend gradually losing 7% of your body weight or more over the course of 1 year. Rapid weight loss through fasting, eating and drinking nothing except water, can make NAFLD worse. Medicine supportive treatment for non-alcoholic steatohepatitis, Nash. No medicines have been approved to treat NAFLD and Nash. However, researchers are studying medicines that may improve these conditions. Some studies suggest that pioglitazone, Actose, a medicine for type 2 diabetes, improves Nash in people who don't have diabetes. However, researchers need more information to find out whether this medicine is safe and effective for long-term use in people with Nash. A study by the National Institute of Diabetes and Digestive and Kidney Diseases Nash Clinical Research Network found that treatment with vitamin E or pioglitazone improved Nash in about half of the people treated. So, doctors may recommend vitamin E for people who have Nash and don't have diabetes or cirrhosis. However, talk with your doctor before taking vitamin E or pioglitazone. For safety reasons, talk with your doctor before using dietary supplements, such as vitamins, or any complementary or alternative medicines or medical practices. Some herbal remedies can actually damage your liver. How does a doctor treat complications of non-alcoholic steatohepatitis, Nash? Specifically, if Nash leads to cirrhosis, doctors can treat the health problems caused by cirrhosis with medicines, operations, and other medical procedures. In particular, if cirrhosis leads to liver failure, you may need a liver transplant. How can I prevent non-alcoholic steatohepatitis, Nash? You may be able to prevent Nash by eating a healthy diet, limiting your portion sizes, and maintaining a healthy weight. Eating, diet, and nutrition, treatment support for Nash. Diet help prevent or treat Nash. If you have Nash, your doctor may recommend gradually losing weight when you are overweight or obese. Also, your doctor may suggest limiting your intake of fats to help prevent or treat Nash, because fats are high in calories and increase your chance of becoming obese. 4 types of fats are: saturated fats, in meat, poultry skin, butter, lard, shortening, and all milk and dairy products except fat-free versions. Trans fats, in foods that list hydrogenated or partially hydrogenated oil on the label, such as crackers and snack foods. Commercially baked goods such as cookies and cakes. And fried foods such as donuts and French fries. Monounsaturated fats, in olive, peanut, and canola oils. Polyunsaturated fats, greatest amounts in corn, soybean, and safflower oils, and many types of nuts. Omega-3 fatty acids are a type of polyunsaturated fat. Sources include oily fish such as salmon, walnuts, and flaxseed oil. Replacing saturated fats and trans fats in your diet with monounsaturated fats and polyunsaturated fats, especially omega-3 fatty acids, may reduce your chance of heart disease if you have NAFLD. Eating, diet, and other nutrition. Your doctor may suggest other dietary changes to help treat Nash. Eat more low glycemic index foods, such as most fruits, vegetables, and whole grains. These foods affect your blood glucose less than high glycemic index foods, such as white bread, white rice, and potatoes. Avoid foods and drinks that contain large amounts of simple sugars, especially fructose. Fructose is in sweetened soft drinks, sports drinks, sweetened tea, and juices. Avoid heavy alcohol use, which can damage your liver. For men, experts define heavy alcohol use as more than 4 drinks per day or more than 14 drinks per week. For women, heavy alcohol use is more than 3 drinks per day or more than 7 drinks per week. 7 days to drink less online alcohol reduction program. Link in the description. Note: understand the causes and prevention of liver disease, so that you can promptly treat the signs and symptoms of the disease. The purpose is to solve your problem. So be open and ready to experiment. At the same time, choose your strategy, take action, and start enjoying the benefits. Reference: The Free Solution for Fatty Liver. Or visit 247naturalhealth.com to all chronic illness information. In particular, if you know Qigong and its miraculous improvements to health, visit falundafa.org. Thank you. I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.